Hi, it's Mary again. It's late. I've been doing these later and later the past few days. I had mentioned yesterday was a very stressful day, and I just wanted to talk about how stress continues to affect me and my symptoms and my illness. I had shared that one of my diagnoses from having a MRI of my brain was that I was having chronic strokes. And over the past 6 years, I have had different parts of my body that don't respond normally. And now with the new diagnosis of the impairment of the autonomic nervous system, more and more things make sense. So yesterday when I was having a lot of stress and I started feeling pain in my head, now I just realize I'm probably stroking. And yesterday's topic I brought up was powerlessness, because people with acute chronic autoimmune are pretty powerless. We can't do things for ourselves. Some of the things that have happened to me because of being tired or being in so much pain. My husband's found me crying in the shower more than once because I can't get my hands up to wash my hair. There's been times that I have spent weeks in the house and he's going to run an errand and I will say, "Oh, I'd like to come too." And he's so patient. He says, "Of course." And he says, "I'll wait until you're ready." But sometimes, some days, it takes me so long to get ready that by the time I'm finished getting ready, I tell him, "I'm too tired to go, and I'm sorry to have asked you to wait." But he doesn't mind, which is just so wonderful. When I hear so many women tell me their family, their husband, their friends think it's all in their head, you have no idea. And what has come to happen is that people with things like Sjogren's and fibromyalgia and chronic fatigue, you don't see anything outside. When I tell people I'm chronically sick, they tell me, "You don't look sick. You look fine. You look normal." And it is so difficult to try to explain the degree of how sick you feel. I visibly show signs of my dry eyes at times when I've had a friend say to me that my eyes look so painful it hurts her to look at me. That I get. That's just one. But there's so many more. The ulcers that I've had in my mouth because of the dry mouth and Sjogren's, the callus on the tip of my tongue because I developed a tic where I was pushing my tongue against my teeth and I didn't know why I was doing it, and I was doing it pretty much unaware after a while. And it's because I had no salivary system, but I hadn't been diagnosed yet, so I didn't know this. And my mouth was so dry, I was just constantly doing these things to try to create moisture in my mouth without realizing it. So when I say things like powerlessness, there's so much that nobody realizes, because you look fine. You don't look like there's anything wrong with you. People might notice that you're doing something strange with your mouth. They might notice that your eyes look very inflamed, but mostly not enough to mention. But after the diagnosis of Sjogren's and lupus, I can't stress enough the importance of keep looking at the sites where people are talking about what's happening with their autoimmune issues, because mine kept progressing to something else. So eventually my lungs were affected. I couldn't breathe. But what actually started the first, beside the dry eye and the dry mouth, my hands started first. They were so painful. And one day I woke up and I couldn't hold a cup. I couldn't hold a pen. I couldn't hold a hairbrush. And I already have depth perception issues with my eyes. So many times I'd go to put a glass or a cup on a table, thinking I'm putting it down, but I totally miss, like it just lands on the floor. And these are daily occurrences. You have to eventually have a sense of humor. I used to tell people, going back at least, I think, 15 years, that I think I had early Alzheimer's, and they would laugh and say, yeah, I'm forgetting things too. Not thinking that I really believe there's definitely something wrong with my brain. And now that I realize that I've had all these strokes and they're impairing my brain function, there's an actual physical reason. However, people with Sjogren's and lupus all have what's called brain fog. So if you're diagnosed with Sjogren's and lupus and you stop looking at information because you have your diagnosis, you don't realize what you're missing out on, because I had said at one point, things that start to occur, you really never understand which block to put them in. Is this a fibromyalgia side effect? Is it Sjogren's? Is it chronic fatigue? Is it lupus? You never know. But now that I have these other diagnoses, I know so much more. But I wouldn't have this knowledge unless I was constantly in the forums sharing and exchanging information, watching people talk about this was going on, and I went to the doctor, and these are the tests he ordered, and this is why this is happening to me. And so eventually, by doing this, I learned to more or less self-diagnose before I went to the doctor, and I'd go to the doctor with a binder of research and paperwork. And some doctors will look at it and some won't. And it's important to do this for yourself, because if you don't advocate for yourself, nobody else is going to do it. And there are so many things out there that the doctors don't even know about that greatly impacts the reason why you're getting all these autoimmune issues. And I'm going to stop now. I'll pick up again tomorrow. But I will just mention one last thing. I mentioned that I had been tested for the BRCA gene because I had breast cancer when I was 36. But they now test for other things also. And one of these is called MTHFR. And if you have this gene, it means that there's so many different variations of that also. I have 2 of the genes. One of my children has 4 of the genes. When you look up what it is, you realize you may have been able to prevent so much of the damage that has been done. One of the issues in one of the MTHFR mutations causes your body to not allow your body to absorb and process vitamin B. And then when you go on and look at all of the symptoms of, say, vitamin B12, you have all these symptoms that you now have a disease. And then you start to wonder, if they had known about this earlier, could I have taken vitamin B's in a form that my body would have absorbed better and prevent my decline into autoimmune? And as we go along further, I'm going to bring up a lot of other things that you need to research on your own, because the doctors don't know about it. It's so rare. However, they are doing much more research into these things because autoimmune is becoming so prevalent. And that's all for today. I hope you had a good day, and I wish you a good night. Bye-bye.